Good morning, travelers, pre-med students, and undergraduates. Welcome to Doctor's Inn. This is where medical experiences are shared, study strategies are examined, and life lessons with a sprinkle of advice and habits are served. It is the TikTok dermatologist, Dr. Dylan Greeney. So the Army veterans that I passionately follow, like David Goggins, Jocko Willink, they always have that go do it yourself, own up to your mistakes, get up, be disciplined, clock is ticking, work hard, that kind of mentality. Would you say that rigorous training and experience overseas trained you to be as hardcore and disciplined in your daily life?
Well, I don't think I can compare myself to Jocko.
That guy is. I don't think anyone can.
No, he's just a whole different breed. It definitely changed my life for the better, without a doubt. Because when I was in high school, and I'm kind of thankful for this, I was not I wasn't super focused on academics. I wasn't an athlete, I wasn't one to burn time at practice playing an instrument or working out. Mm-hmm. I think it's wonderful. I wish I had those skills now, right? But it was really taking that break, because I could have easily rolled into community college or something like that and done IT. But taking that break allowed me to come back and really appreciate learning a whole lot more and take it with a seriousness. I came back with a very laser focus on the idea of becoming a physician. So it made everything much easier to prioritize. I just came back, and then again, it's kind of like doing what you got to do and buckle down in that. And I just think it gave me a sense of maturity. I think seeing things in the war, of course, puts everything in perspective of what's important and what you need to worry about. So I think it alleviated some anxiety on that front too. Although having anxiety as a pre-med student, no matter what, is warranted and justified.
Yeah. Would you say, okay, so it seems that your discipline definitely carried over to medical school and having that pinpoint focus, right?
Mm-hmm. I'd say so.
Speaking of medical school as a non-trad, there are some anecdotal speculations that it is often harder to get into medical school as a non-traditional student. So what helped you stand out as a non-trad? Do you have any recommendations for other non-traditional students or any students in general who are applying to medical school?
Yeah, for sure. So, I definitely think I would shift that line of thinking. I don't know what the statistics show, but I think that you're actually coming from a position of strength as a non-traditional applicant.
Yeah.
Without a doubt. I think it's much better, because people have went out, they've lived life experiences, they've possibly worked in careers, and you got to really know how to frame all the skills that you gained in those experiences. Mm-hmm. It's easy you could not frame them well, and you could not present yourself well, and it would make it a whole lot less meaningful, and maybe make your journey look a little chaotic and unplanned. But if you can highlight your failures, how you overcome them, highlight your strengths that you develop through this, of course, like working in business or anything like that, you're learning communication skills that are critically important in medicine and those kind of things. So you're really coming from a position of strength, and just the fact that when you get to an interview, if someone has a very straightforward, and maybe they had it figured out from the get-go, right? And they just did it straight through high school, college, med school, straight up. Mm-hmm. That's totally fine. But I think you really stand yourself out, and you have a whole lot more to talk about, folks, when you've lived some of these other life experiences. You can speak to why this is the next step you want to go, like what pushed you in your life to get to this point. And it just makes for a lot more justified, kind of a meaningful line. Yeah. So I think one of the most important things is you have to remember what your drive was like when you were trying to get to where you're going. So it's like you look back at when you're a pre-med and how much motivation you had and how much desire you had and how much you would give up to just get to where you want to be. And so it's so easy when you go through a process, you work hard hours, you face adversity. You got to look back and think, man, what would pre-med me tell myself, And I think that's probably one of the best ways to frame things and keep you motivated.